Hi there. This is Dr. Aruna Tummala here. You probably don't see, you're only going to hear my voice, but we have Margaret here with us today. Margaret and I have been working with each other since January of 2019. And I'll give you a little bit of introduction and then I'll have Margaret talk about her experience. So Margaret was diagnosed with bipolar disorder many years ago, and she's been in treatment. That part of it was somewhat stable, except that depression was still difficult to control. But then she also had a head injury in March of 2018, and it is after that that she began to experience many more symptoms. And I'll have Margaret talk about that a little bit. And Margaret will also be talking about the treatment that she's received and how she's doing now. Go on, Margaret.
Okay. Again, as Dr. Tummala said, I was diagnosed with bipolar disorder when I was 30. I am now 64. I was given a number of different medications to treat the bipolar, and many of them did not work. So it was a juggling act of coming off of certain meds and going on different meds, finally settling on Depakote, Nifazodone, and venlafaxine. And those are very good for me for about 20 years, I would say. There are black boxes on some of those medications, so those were a concern. The psychiatrist I was seeing prior to now became very ill with cancer, so his patients were dispersed among other doctors in that clinic, or you found your own psychiatrist. I happened to opt out for looking for a different psychiatrist, doing research on the internet, and I found Dr. Tummala. I'm very pleased that I did. My first appointment was in January, and at that time we discussed my manic depression. We discussed all of my medications for manic depression and all other medications I was taking for various other conditions. Many medications were discontinued. My opiates were discontinued. All of my anti-inflammatories, the ibuprofens, were discontinued because those were an irritant to my ulcerative colitis.
Yes, yeah.
So those were all discontinued, and they were.
I think we basically what from our perspective, what we figured is that again, it's the gut-brain axis that is mostly dysfunctional in patients with psychiatric problems.
Mm-hmm.
And your ulcerative colitis and your bipolar disorder were not two different entities. They were rather the manifestation of the same inflammation in the gut-brain axis. That's how we understood. And so our treatment protocol really incorporated diet and those changes, which you've been a great trooper. But in your years struggling with the ulcerative colitis, you also figured that gluten and dairy were not agreeing with you. But hearing that as a formal recommendation of your treatment really helped you to kind of be more strict with that, and also taking some of the Ayurvedic supplements. Your ulcerative colitis excuse me, has also gotten significantly better now.
I was kind of getting ahead of myself. Some of the first things we discussed and that I started to put into practice with my first visit in January were getting rid of the opiates and the ibuprofens, but also adopting a new lifestyle change.
Mm-hmm.
My diet was the first one. The meats that I could and could not eat, how I had to prepare my vegetables. There were 2 supplements I was given. One of them was for calmness,
Mm-hmm.
and the other one, I can't remember the name of it. And then there was a powder that I was given
Yes.
that helped with quieting my gut.
That inflammation.
And it also really helped with my microscopic ulcerative colitis. I no longer take any of those medications for colitis, and as I was so thrilled to be able to report to Dr. Tummala later was that my daily constitutional is so regular I can set a clock by it. So my colitis is no longer an issue unless I eat something that I shouldn't and then I pay for it, but that's very few and far between. So my food preparation since January has followed a very strict ruling. Everything is sauteed, and it's sauteed in ghee. I make my own ghee. I use American spices, and I've also purchased a number of spices from India. So I have a nice blend and mixture of things for preparing my food.
You're making me hungry now. I know you are a really good cook, and that always helps. But really the openness in because this is the first time in all your life that this kind of a approach to health was provided, and really connecting the two, the ulcerative colitis and bipolar together. But the other thing that was actually quite concerning for me was the symptoms that you had from the concussion that you suffered at your workplace on March 7th, 2018. And the sad part was that those things were completely not addressed at all in the treatment that you were receiving before. In my first evaluation, I found that you were having word finding difficulties. You had dysarthria, which is that you could not pronounce certain words very well, and some of your words were very slurred. In fact, remember I asked you, is this how you normally speak? And then
it is now.
Now it is all gone.
It's all gone.
It is all gone. Your memory was off. You were having gait and balance issues, and you were having these constant headaches, which is why you had to take ibuprofen. And again, ibuprofen is bad for your ulcerative colitis. And then you were also given opiates to help with the headaches. But again, all of that was inflammation. But with headaches, what I've learned in functional medicine is that there are certain supplements, whether it is fish oil or NAC, which really has shown a lot of promise in post-concussional syndrome. And although it had been nearly 10 months after the injury that we started this protocol, you've recovered wonderfully.
Yes, I have. With the concussion, the injury was at work. I had fallen backwards and hit the back of my head, first on a stainless steel dialysis machine or a cast steel dialysis machine, then concrete, and went to the ER and went to my primary care physician, but I still was not satisfied with what I had learned, so I had an MRI done, and that was inconclusive. There were no brain bleeds, and I was sent to a concussion specialist who said that there really were no studies on women my age, especially, or people my age, or especially people with mental health issues, bipolar. Most of their studies were on males, high school, college, sports injuries. So I began to think that this was how I was going to live for the rest of my life, having word searching difficulty, memory loss,
gait issues.
I was still falling a lot. I was having difficulty walking. In fact, I would drag one of my legs to the point that I needed to have knee surgery for the third time on a knee that had 2 prior surgeries because it was destroying the cartilage. Slurred speech and just, headaches. I was still taking naps a lot, and I thought, I'm only 63, this is how I'm going to live for the rest of my life. My psychiatrist had no answers to this. He did increase my Effexor because he said that might help with the headaches. So then, fast forward to coming to see Dr. Tummala, with the treatment, dropping opiates, dropping ibuprofens, discussing so many different things. She prescribed NAC, which helps with headaches and concussions, and my dietary changes, just working at a lot of things, taking her advice on things that she made suggestions of. One of my medications, the Depakote, she was able to decrease that by a small portion. She decreased my Effexor by a small portion, small dosing, and my nifazodone has been, over a number of months, titrated down to a point where I'm almost done with that. I am feeling wonderful. I'm feeling the best I have felt in a long time. It's been over a year and a half now since my concussion. I feel my strength back. I feel my memory back. I feel my speech is better. My diet, I just feel all over better. And not being on all these meds, I have a certain feeling of confidence and well-being that I am not dependent on these medications to treat my bipolar. Obviously, if you don't know, there is no cure for bipolar, but there's treatment. And now I'm finding my feelings are that I was being over-treated, over-medicated for my bipolar, and because I've been functioning for probably 4 or 5 months without the full dosing of medication, I don't need it. Dr. Tummala and I will be in contact all the time.
Yes.
If I ever find I need to go back on it or try a different line of medication, like a satellite, I don't know what it would be,
No, the thing is that, mental illness, including bipolar disorder, we really need to understand what is the root cause of it, right? And in most, what I've come to see using functional medicine principles and Ayurvedic principles is that all of this is a manifestation of inflammation in the whole body, not just in the brain. It typically starts in the gut. So that's why in your situation, the treatment of ulcerative colitis had to be the first thing to treat your bipolar disorder. In other words, your bipolar disorder would not get better unless we treated your ulcerative colitis. So that has been our focus all along. Now, with the nefazodone, you were having abnormal liver function tests. That was the main reason why we talked about going off of the nefazodone. And if your mood maintains itself with all these things that we have done, I mean, you're physically much more healthier in your brain and in your body now than you were before you came to me. So that means that your need for too many medications will automatically come down. But whether we'll be able to completely take off the Depakote or not only remains to be seen. We have to work. But I feel with the progress that you have made, now we are off of the nefazodone. In the beginning, you had a little bit of sleep difficulties, but that's not happened again. And we are also working on FXR. That's going to be a little bit of a tricky one. But maybe only with Depakote, at its lowest dose, we'll be able to give you that best balance between health and the medications. That is what I'm working towards. And but I mean, in general, when you take a big polypharmacy of these medicines, you're putting that much stress on your liver to metabolize and detoxify them. And of course, these medications do come with their own long list of side effects. All of them have something or the other.
And some are very expensive. I mean, it's just ridiculously expensive.
Yes, yeah. So again, it is really about finding that right balance between lifestyle changes and the medications that we can use for a person to feel and truly become healthy. And that, it's been a pleasure working with you, Margaret.
Thank you. It's been a pleasure working with you too.
Thank you.
And feeling so much better.
Thank you.
And it was hardly like work at all.
Yes. For me as well. All right.